Good morning and welcome to His Excellency Rector of Universitas Gunadarma, Ibu Profesor Dr. E.S Margianti, SMM. His Excellency Rector of Bukhara State University, Profesor Dr. Obijon Hafizovic Hamidov. His Excellency Vice Rector 4 of Universitas Gunadarma, Profesor Dr. Didin Mukodim. The Honorable, the Representative of Indonesian Association of Midwifery, Bidan Lili Anggraini SST MH The Committee Chair of the Conference, Ibu Rochmawati SST M.Keb Magister Kebidanan. The all respective speakers, Ibu Novi Marthiany Haris, American Writers. Noriko Taniguch, Midwife from Nori Jyosanin Clinic, Nori Maternity House, Kanagawa, Japan. Dr. Estu Lovita Pembayun SST M.Keb, Lecturer in Bachelor Midwifery, Universitas Gunadarma. Sadulloyeva Mahfuza Gaybulloyevna, Lecturer at Bukhara State University, Uzbekistan. Boymurodova Nodirabegim, Bahodir Kizi, Lecturer at Bukhara State University, Uzbekistan. The respective delegation or representative of the partner hospital and public health center around Jakarta, Depok, and Bogor. Dean, the head and the secretary of study program amongst Universitas Gunadarma. Colleagues, participants, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Shalom, Om Swastiastu, Namo Buddhaya, Salam Kebajikan, Rahayu. My name is Astie Darmayantie and I will be the master of ceremony of today's event. It is a great honor for me to stand here and to welcome, and I will be guiding you throughout the agenda of today's event. I would like to convey a very good morning to participants joining from Indonesia, Japan, and Uzbekistan, and also a good evening for participants joining from the United States. Welcome to the second International Conference on Midwifery, Maintaining Balance, Mental Health and Well-being of Mothers and Children in Modern Era. This conference is to bring together academia, researchers, practitioners, and policymakers to explore the importance of maintaining mental health and well-being amongst mothers and children in the modern era. Excellencies, distinguished guests, participants, ladies and gentlemen, moving forward, allow us to commence the event by solemnly singing the national anthem of Indonesia. Participants joining in studio, please rise for national anthem of Indonesia, Indonesia Raya. Participants, you may be seated. Distinguished guests, participants, ladies and gentlemen, moving forward to our first agenda, we would like to cordially invite Ibu Rochmawati SST Magister Kebidanan as the chairwoman of the committee to deliver her report. To Ibu Rochmawati SST Magister Kebidanan, floor is yours.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Shalom, Om Swastiastu, Namo Buddhaya, Salam Kebajikan, Rahayu. Welcome to Gunadarma University. It is my pleasure to welcome all the participants today in the conference seminar, in international conference on midwifery, maintaining balance, mental health, and well-being of mothers and children in the modern era. We'd like to extend a special welcome to our guest of honor, Rector of Gunadarma University, Professor Dr. E.S Margianti, SAMM, Rector of Bukhara University, Vice Rector for Development, International Affairs and Collaboration, Professor Dr. Didin Mukodim, Dean and Secretary of the Faculty of Health Science and Pharmacy, Professor Arini, Dean and Secretary of the Faculty of Medicine, Professor Dr. Sukman Tulus Putra, SPA Konsultan, heads of study programs in Gunadarma University. I also welcome all our speakers who join us online via Zoom meeting and offline to share their knowledge and vast experience in this topic. Ms. Noriko Taniguch, Ms. Sadulloyeva Mahfuza Gaybulloyevna, Ms. Boymurodova Nodirabegim Bahodir Kizi, Ms. Novi M. Haris, and Mrs. Estu Lovita. Last but not least, our guest chairman of IPKIN, Mrs. Dr. Randa Jumiarni Ilyas, M.Keb, guests from IBDKI Jakarta, hospitals, health centers, and lecture students who participate this conference offline and online. I, Rochmawati, as chairman of committee of this conference, would like to report on today's event. This conference will take on a topic maintaining balance, mental health, and well-being of mothers and children in the modern era. Attended by 5 speakers, conducted by 5 speakers from Japan, Uzbekistan, and Indonesia. The conference is a hybrid conference conducted in offline and online mode. Participants will come from several countries who join online, where there more 300 participants and 300 participants, and there were 160 participants who attend this conference online. Thank you for your all hard work of all the members of the committee who are involved and organize this event. Also, thank you to Gunadarma University for supporting this conference. We really hope that today's conference will provide many benefits. To all of our guests and participants, thank you for being here. Welcome and enjoy conference. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Ibu Rochmawati, for the report. Excellencies, participants, distinguished guests, ladies and gentlemen, following the agenda, we would like to cordially invite the Rector of University Gunadarma, Professor Dr. E.S Margianti, SMM, to deliver her speech and to officially open the second international conference in Midwifery, maintaining balanced mental health and well-being of mothers and children in the modern era. To Professor Dr. E.S Margianti, SMM, time is yours.
Very good morning. Assalamualaikum warahmatullahi wabarakatuh. Distinguished guests, ladies and gentlemen, all the, all the pimpinan of the Gunadarma University, all the chairperson, chairman of the university or body from that participate in this occasion from state, the speaker from state, US, and then also from Japan, and also from Bukhara University. Very good morning, Mr. Ojan. How are you? I'm very fine here. And also the distinguished speaker, everybody that can join this occasion. Assalamualaikum warahmatullahi wabarakatuh. Om Swastiastu, Namo Buddhaya, Salam Kebajikan Rahayu. First of all, of course, let us pray and thank so much for our Almighty God that we have this opportunity to be together in this very special occasion, that we are together from Japan, Indonesia, Uzbekistan, and also as well the United States. We will share our so many way of thinking, so many point of view about midwifery in very aspect of our life, of course. I'm sure, and I believe that the function of the bidan, we call it bidan in Indonesia, midwifery, it is very important for us, especially for in the process of mothering, of course, in the delivery process. We are desperately hope somebody to help us. And of course, in this special era that mentioned in the topic was in the modern era, which is can be actually I'm a little bit questioning about the topic of in the modern, because it is very wide, you know. Maybe we can focus on the 5.0 sociality in this moment, or maybe more, or maybe far before. But it is, we can define it as modern. So maybe we should be more special in this term of the modern life. But it is, I believe that it is, and also I agree that it is very important for us. So on behalf of Gunadarma University, big family, I'm very appreciate, and also I'm of course fully support of this occasion, and I'm looking forward to hear the result of this international conference or international conference, and then later on I'm looking forward for the next step of after this activity. So I hope that we have a continuing process from starting from this event, the sharing idea and the other, and we have some conclusion of later on we can go on. So I'm very sorry that I can present in this occasion by myself, but of course through this opportunity, doing this taping and other, I wish you all very good and very fruitful activities, and then also we can use this result for continuing, or also for having more people about this topic, of course. So please allow me, let me open this activities, this occasion, and also of course on your permission, and then also, of course, in the name of Allah, Bismillahirrahmanirrahim, I officially open this occasion. I hope Allah will always with us, and also always illuminating our step ahead in the future. And then also I hope, as we are always mentioned, that Gunadarma untuk Indonesia, Gunadarma for Indonesia, we will be very grateful to Indonesia. Kata Rahmat, thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you, Professor Dr. E.S Margianti, SMM, for the message and also the motivation. And ladies and gentlemen, in today's fast-paced and ever-evolving world, the demand on mothers and their children have reached unprecedented levels. The issue into the mental health and the well-being of mothers and children in the modern era delves into the multifaceted nature. And in just a moment, we will have 5 wonderful speakers from 3 renowned institutions to share their experience on mental health and well-being of the mothers and children. Our warmest welcome once again to our speakers. Please give a round of applause. And this session will be organized into 2 parts and will be moderated by 2 of our wonderful lecturers, which is Dr. Ira Puspitawati, MPSI Psikolog, and also Ibu Liana Elfaristo, SST Magister Kebidanan. And before we proceed, please enjoy Gunadarma untuk Indonesia by the Academy Band.
Di kampus ini aku bahagia, berbagi cerita penuh makna, bersama dalam menuntut ilmu. Di Gunadarma kita telah bertemu. Jadilah diriku mahasiswamu, ku berikan yang terbaik untukmu. Gapai mimpi dan baktikan dharmaku, Gunadarma untuk Indonesia. Satu dalam masa warnai dunia, raihlah semua angan dan cita-cita, berjalan bersama dalam satu cinta. Gunadarma untuk Indonesia selamanya. Setiap waktu kan ku ingat sepanjang hidupku. Gapai mimpi dan baktikan dharmaku, Gunadarma untuk Indonesia. Satu dalam masa warnai raihlah semua angan dan cita-cita, berjalan bersama dalam satu cinta. Gunadarma untuk Indonesia. Satu dalam asa warnai dunia, raihlah semua angan dan cita-cita, berjalan satu cinta. Gunadarma untuk Indonesia selamanya.
Excellencies, participants, distinguished guests, ladies and gentlemen, welcome back to the second International Conference on Midwifery, Maintaining Balance, Mental Health and Well-being of Mothers and Children in the Modern Era. And this session will be moderated by Dr. Ila Puspitawati, MPSI Psikolog, and also Ibu Liana Elfaristo, SST Magister Kebidanan. And before we proceed to this session, please take a look of the profile of the moderators today. And without any further ado, please welcome Dr. Ira Puspitawati, Psikolog, and also Ibu Liana Elfaristo, SST Magister Kebidanan.
Astie Darmayantie. Good morning, our distinguished speakers, our rector of Gunadarma University and our rector from Bukhara State University, Uzbekistan, our honorable vice rector, head of faculty, our dearest colleague, and everyone who participated in this seminar. Once again, we greet you welcome to the second International Conference on Midwifery, Maintaining Balance, Mental Health and Well-being of Mothers and Children in the Modern Era. I am Ira Puspitawati and Ibu Liana Elfaristo. We will be your moderator for this conference today.
Health and well-being are a crucial aspect for overall health, and they are particularly important for mothers and children. In today's fast-paced and demanding world, it can be challenging to maintain mental well amidst the various pressure and responsibility we face. The seminar aimed to shed light on the unique mental health challenge faced by mothers and children in the modern era. We will explore the factors that contributed to these challenges and discuss effective strategies to promote mental well-being within the family unit.
Yes, and to ensure a comprehensive exploration of this seminar, we will have two sessions, like mentioned by our MC, each featuring presenter from their expertise. We are fortunate to have with us today 5 speakers who are leading in their respective fields from USA, Japan, Uzbekistan, as well as Indonesia. Joining with us in this first session, Mrs. Novi Marthiany Haris. She is a postpartum psychosis survivor from Texas, and Mrs. Noriko Taniguch, midwife from Nori Jyosanin Clinic, Nori Maternity House, Kanagawa, Japan. Hello, Mrs. Harris and Mrs. Taniguch, are you in the Zoom room now?
Hello.
Yes.
This is Novi. Can you hear me well?
Hi, I'm okay.
Yes. Hello.
Can you see my PowerPoint now?
Okay, maybe we will present later, but we will continue with Mrs. Harris. I think it is good evening for you, Ms. Harris, in Texas, USA.
Yeah, so right now it's actually exactly 12 hours differences. So it's 8:50 at the night in Dallas, Texas.
Okay. Mrs. Liana, could you continue?
Baik, thank you. Without further ado, let's commence on our first session. In this first session, we will hear from Ms. Novi Margianti Haris about from surviving to thriving, postpartum psychosis journey of resilience and implementation of mental health services for mother and children in Japan from Ms. Noriko Taniguch. To start our seminar today, we are honored to have Ms. Haris joining us as our first speaker. The courageous advocate of mental health awareness and survivor of postpartum psychosis, her inspiring story has been featured in anthology book, Mommies, You Are Not Alone, which is published by Mother Hope Indonesia. Today, Ms. Haris will share her personal experience of navigating postpartum psychosis and the power of resilience in overcoming challenge. Before we begin, I'd like to take a moment to introduce our speaker through the CV. Thank you for taking time to speak with us today, Ms. Haris. We are excited to learn from your experience and knowledge in postpartum psychosis journey. Let's give a warm welcome to our first speaker today, Ms. Novi. The time is yours. Please take the next 20 minutes to share your insight with us.
Good morning, everyone. Assalamualaikum warahmatullahi wabarakatuh. Thank you for this opportunity. My name is Novi Marthiany Haris. I'm an Indonesian living in Texas. I've been living in Texas for about 15 years. I work as a biolab head at the Pro Museum of Nature and Science, Dallas, Texas. But I'm here to actually sharing about my personal experience more rather than professional experience. So this is more about my personal experience as a mother, as a patient, as a survivor of one of the mental disorder that related to maternity, postpartum psychosis, and also my involvement in research project for postpartum psychosis. So can I just ask a question? Can you see my screen sharing? Okay. Yes. All right. So in here, I wonder if that you are all familiar with postpartum psychosis. If not so many people are familiar about it, I think I can understand, because this is like very rare disease that is like about 1 to 1,000 women that experience this. But this is actually the severe version of the other postpartum illness, just like the baby blues. Baby blues is more common. And then postpartum depression, also like less common than baby blues, but more common than postpartum psychosis. So people who usually have depression, people who have psychosis, usually they always experience depression also, but people with depression, not necessarily they have the postpartum psychosis. Okay.
Mrs. Novi, could you make a slideshow so we can see clearly on the presentation?
Okay.
Thank you. Or maybe would you like to let us present the presentation? If you have any trouble with it's okay. It's fine.
Okay.
Yes, thank you, Ms. Novi.
Okay. All right. So this is. I'm gonna just because it's very limited, so I'm just gonna limit my agenda here. I'm just going to talk about what I experienced, what I wish I knew, what helped me the most, and what I can do next. So if you see these pictures that I picked for this presentation, those 2 pictures are actually, if you just look at it, it looks like just regular after birth family, happy. But what I remember from that picture is actually I was walking my daughter with the stroller to the nature area that I used to like. And I usually feel very peaceful, just strolling around that jogging track in the nature area. But at that exact time, I actually didn't feel any joy, anything. It's just like my brain was foggy. I couldn't feel happiness. I feel like overwhelmed, and I couldn't think clearly. And I remember my doctor, she told me about how, like, when you have depression, you're actually, there's something wrong with your receptor of happiness. So even when I'm surrounded with the happiness around me, if I have depression, your receptor is broken or something else, something like that. So I couldn't really feel the happiness. So it's not just about tired, weak, or something wrong with your brain. That's what my doctor said. And the picture of my husband and my daughter, it's just a simple picture of she's wearing a dinosaur clothes, and it's cute. But one time my friend told me, "Oh, your daughter looks like a boy," and then also she wear dinosaur clothes. Even just like that comments with my brain already like weird, it can trigger like overreaction and overthinking because I was sick. So we're gonna continue to the next. So my experience is actually cognitive decline. That's something that I didn't know that it was part of depression, because like at the beginning, initially after giving birth, I felt like a very drastic decrease in cognitive function. Like I learned how to use breast pump, adjusting the car seat and stroller became a tough task. Even I had to read instruction many times, but I couldn't figure it out. My brain was overwhelmed, not like I normally. I was confused by my brain is slow. Like cooking is one of the activities that frustrates me to overwhelm me. Like many recipes that I used to like, no, I couldn't remember. You just have to write the instruction on the recipe many times because it was so hard to concentrate. And then I usually like to open the social media, check on my phone, but even to use the GPS, I couldn't do it. My husband told me that when I was sick, I couldn't even like think about what I should wear outside. It was just choosing clothes was overwhelmed. Like I couldn't do it. I wear the same clothes, shoes every day at that time. Even simple thing like choosing and ordering diaper online, like overwhelm my brain. It's also take a long time for me to get ready to leave the house and prepare the baby equipment for travel. So all these like ambitious ideals, such like taking a baby on a trip, I had to destroy it deeply. So I was thinking, how are you gonna pack and travel if you just leaving the house, leave you confused? So all of this like caused me to be extremely frustrated and anxious, and it showed the depressing thoughts like, why I'm so slow? How can I be a good mother if doing a simple thing took me a long time. So this feeling of like, oh, I'm so incapable. Why I'm like this? I cannot be a mother. So these feelings develop into like feelings of guilt and low self-esteem. And later I found out from the psychiatrist in the emergency room that what I was experiencing was called like pseudo-dementia, like difficulty concentration, forgetfulness, that usually come with the depression. So delusional thought is just later after my depression getting very worse. This delusional thoughts about like weird things, that this is the psychosis kick in, like, oh, everybody in the world knows that I'm a incapable mother. Every time I go outside, they look at me like, ooh, that girl cannot take care of the baby. And this is weird, very, very weird. But that was the psychotic depression that came with the very delusional thought. And it also lead me to self-harm and self-blame behavior. Like at night when I couldn't sleep, I'm just like scratching my arms, like scratching myself. It's like, I hate myself. Why I couldn't do this? Why I'm not a capable mother? Kind of, something like that. So this is the exact timeline of since when I gave birth until the end of my, this is the timeline of, until the end of my completely stopping the medication. So I gave birth delivery at September 2016. And then about 2 months later, like the one that I told you about, overwhelm, cognitive decline, negative thought. What interesting in here is like at the 2 months pediatrician visit, for my daughter, this pediatrician actually already observed that I wasn't myself. That was things that I thought that like all healthcare worker should be, should know about this, like observing. So this pediatrician, like when I was in the restroom, he offered my my husband to, are you wife? Do you wife okay? Do you think I need to prescribe some things? It seems like she had depression, like anxiety. But of course, as a person who like, I was so like too much pride to take medication, which I learned the hard way. I needed to take it. I didn't want to take any medication, and my husband no. So we just kind of like, oh, this is just like after birth brain. It's okay. It will disappear, which was totally wrong. And then on December 2016, I started to feel like my brain was hijacked. I went to the OBGYN to control afterbirth, but then the OBGYN said that I can prescribe you the antidepressant, but it seems like you also have psychosis, so you have to go to the psychiatrist. And then also the medication that she prescribed didn't work because, like, I think different people like match with different medication. On January 2017, my delusion and my weird belief is like growing so weird and even more odd. And I had this paranoid about I was fired from work. And yeah, my boss hated me when I went to work. I feel like everybody talking about me. And then I told my sister in Indonesia that Child Protection Service will take my baby because I wasn't able to take care of it. And then, so the peak was when my boss came to visit me because she wanted to confirm my husband that no, she didn't fire me. So what happened with Novi? And then she looked at me and I wasn't myself. And she told my husband, I think your wife need to go to the emergency room. So after that, I also like my self-harm become really, really worse. That's when I took a trip to emergency psychiatrist. So from January 2017 to July 2018, it's like the time where I was like under supervision of the psychiatrist. And on July 2018, I was finally stated like I was fully recovered without medication and I was free. So it was a very, very long journey. And I feel like if I knew, things that I didn't know at that time, it wouldn't be like this. So it didn't have to be like this. So what I wish I knew that it is okay to feel tired and ask for help. That when I went to the OBGYN, I was so guilty, like, oh, this is only depression. She must be like very busy with something else. Depression is just like weak and blah, 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 because I didn't know about it. But it's okay to feel tired and ask for help. It's okay if you had depression, maybe your brain was not correct and you need the medication. So, and I also didn't know that the depression can be so disabling. Like I told you before, it's not only about tired and sad, it's also you cannot function. On my case, I couldn't function at all. Like reading that I really like, I couldn't read that I couldn't comprehend. I wish that I knew that the postpartum psychosis is a medical emergency, so I could get the help faster. And I wish that I knew that postpartum psychosis, as severe as it is, actually can be treated and recovered from. Okay, until here, can I ask the moderator how much time I have left so I can?
7 minutes from now, Ms. Novi.
Okay.
Yes.
Okay. So yeah, make it quick. So this is what my family support looks like. So this is my testimony that I put in the Massachusetts General Hospital postpartum psychosis
Recording
project.
in progress.
And it took a village to raise a kid, and I couldn't have done without my sister. When I was discharged after a week in the hospital, my psychiatrist told me that I could not be left alone with baby yet. It was hard because my husband had to go back to work. He used all his paid time off and sick days to take care of me. When my sister flew 10,000 miles from Indonesia to be caretaker during my postpartum psychosis recovery, she is a psychologist and she left her job in Indonesia for months until I was stable enough to take care of my baby. She said she helped a lot of clients and it was time to help family. She was amazing. It took a village to raise a kid and I couldn't have done without her. And this is just example of professional support looks like from my doctor, because we had this intense communication and he allowed me to ask about everything from the medication, why I couldn't sleep, and what is the name of this, my sickness, why it's not in the DSM. And yeah, just every little thing. He was a very empathetic and a very good communicative doctor. So what I can do next is writing. So when I wrote my experience on the blog at that time, actually I was just like kind of as a therapy for myself, so I can remember the chronological about what happened. I can share to my daughter later. But what I didn't know, the writing, besides it helps myself, it also can help people. So when my writing on the blog became viral, I received a lot of people who told me that, hey, this is really helpful for me. You know, can I kind of print it in my hospital for the training for the healthcare worker? Or there's also one person who schizophrenic and mother, and she told me that a little bit my experience was actually kind of similar to her, and she want to print it for her daughter too, so let her know her mother's struggle. And I became active in the community advocating for mental health. So I went from the very skeptical about mental health to advocating for mental health. I also participate in the research project about postpartum psychosis, where I actually submitted my DNA, went to Boston to get my MRI, the questionnaire testimony. So because in my case, it's very rare, usually postpartum psychosis that they have this bipolar before, and also, but I don't have a history of mental illness before that. So the case of postpartum psychosis who has no history of schizoaffective disorder, it was very rare. So they were interested to take my brain and sample my genetic and everything. This is the blog that I wrote in Indonesia. If you're interested, you can always put it in the Google Translate. And this is the website from the Massachusetts General Hospital postpartum psychosis project that I was involved with. Okay, so I guess that's all. And if you have any question, we can talk about it later in the question Q&A session, because I think the moderator, I think I'm done, right?
Yes, thank you very much, Mrs. Harris.
Thank you so much. Thank you so much.
This is time for us to continue our presentation. I hope you can stay for about 30 minutes from now, because we are going to continue to our second speaker. But thank you very much for sharing your incredibly informative and inspiring story. Your courage and resilience are truly remarkable for us, and I'm sure your insight have resonated deeply with our audience. Maybe some of our viewers in UGTV and participants in the Zoom room are eager to engage with you further, but let's hold off on questions For now, as we move to our next speaker, Mrs. Noriko Taniguch, that will bring us to Japan. Hello, Mrs. Noriko. Are you in the Zoom room now?
Yeah, okay.
Did you hear me?
I will start my presentation.
Okay. Before we continue to Mrs. Noriko's insightful presentation, let's take a moment to familiarize ourselves with her impressive background by taking a brief look at her CV. Thank you. Without any further words, let's give a warm welcome to our esteemed speaker, Mrs. Noriko Taniguch. The time is yours. Please take the next 20 minutes to share your insight with us.
Hey, thank you very much for inviting me today. I'm very happy to have this opportunity. Can you see my presentation?
Maybe it's on the way. Could you please present it? Okay.
Yeah, already.
It's very clear. Thank you.
Okay. I will start. Let's go. I would like to introduce myself, Bahasa Indonesia. Saya bisa sedikit saja bahasa Indonesia. Okay. Saya praktik ke bidang orang Jepang, tinggal di menjalankan rumah bidan di Kanagawa. Proyek Kanagawa terletak di sebelah Tokyo. Apakah semua suka manga tentang budaya Jepang? Karena kota saya situ suci manga Slam Dunk di dekatnya. Banyak wisatawan berkunjung dari seluruh dunia. Okay, let's move to main topics. I would like to start by talking about mental health in Japan with this graph. This graph shows a trend in number of births. The Ministry of Health, Labor and Welfare released the approximate number of vital statistics on 5th this month for 2023. According to the report, the total fertility rate, which measures the number of the children a woman gives birth to over her lifetime, it was 1.20. Compared to the final value for 2022, it decreased by 0.06 points, and it was lower than the previous year for the 8th consecutive year. Tokyo has the lowest area total fertility rate in Japan. Okay, next, I will explain the factors behind the decline in Japan total fertility rate. First of there is the advancement of women in society. Japan is still a country where there are few women in the management position. It was said that women participation in social is one of the factors. Along with this, it is related to the difficulty of balance work and child care. Next, there are situations where small family, not an extended family, like Indonesia. This is common in Japan now. As a result, there is a current situation where child raising is done alone. Finally, parents aging and caregiving. These various factors may be responsible for the decline in the total fertility rate. Furthermore, in recent years, there has been an increase in number of the cases of women developing postpartum depression due to the lack of solid support after childbirth. Okay. would like to explain the key points of the measure that Japan government is working on to address the decline birth rate. The first is reduce the financial burden of childbirth. There are 14 vouchers for prenatal checkups. They try not to spend money during pregnant checkups. Next, Japan government focus on provide continued support from pregnancy to postpartum. As mentioned above, modern Japanese people live in nuclear families, and many of them live without having seen baby. As a result, many people do not have an image of life with a baby, and the number of people who suffer from postpartum depression is increased. Next, which is on the rise in Japan. In my country, there is data that about 12% of postpartum women develop new mental illness within 3 months after giving birth. The most common disease is postpartum depression at 5%. The next most common symptom was 4.8%, which was a not definitive diagnosis of depression. But it was severe enough to interfere with daily life. I'm working as a midwife in community. I think it's a lot more than dates presented here. Postpartum mothers are also in the period change in the hormone balance, and there are many changes in feelings. I feel that presence of midwives and medical professionals who are close to notice slight changes in mothers' work, words, and action is significant. It is not uncommon for people to commit suicide due to postpartum depression or mental depression. The suicide rate in Japan is very high. Compared to other countries, it is one of the cases of maternal mortality. From here, I would like to explain Japan continuous support. In my country, when ready, find out pregnant, they check up for a kid of pregnant. She goes to first, so they went to the hospital and then doctor diagnoses pregnant. And she goes to the city hall and get a maternal and child health handbook. We call it the mother's book. At that time, she will have an interview with a midwife or public health nurse. If lady has any financial or emotional problems, city hall staff communicate with midwife in the community, or hospital midwife provide mental health follow-up for during pregnancy. In addition, we will collaborate with medical social worker or doctor as a professional as needed to provide support for pregnant women. Next, I talked about after birth. Midwife close and deeply supports the woman and her baby every day after giving birth. On the 5th day after giving birth, carry out the Edinburgh postpartum depression question sheet during their hospital or midwife house day after giving birth. Depending on the result on the question sheet, mother will receive support from the midwife as soon as she returns home. This will lead ongoing to support. It's about the postpartum period. each family has different place to return in Japan. As it is here, someone go back to home, other one go back to mother's parents' home. Some mother and babies whose husbands are so busy and have no support for them go back to like a hotel. They need a lot of money. Therefore, the support are different. I feel that this also has a significant impact on the mental health of postpartum moms. Many mothers and children who return home receive perinatal or neonatal home visits. Japanese midwife visit postpartum women at their homes up to 4 months after giving birth. Check on the physical condition or mother and baby and advice on breastfeeding, how to take care of herself at home. Answer, yeah, that's right. And then so mother answers the Ejimba postpartum depression question again at home, maybe around 1 month. Furthermore, as a support system, we will introduce services such as postpartum care. Next, I talked to you about postpartum care in Japan. We provide the 3 types of postpartum care. Accommodation type is mother will stay at facilities that provides a postpartum care. They can receive the service such as meal or snack and child care support. The time spent is usually 10 o'clock in the morning to 5 o'clock the evening the next day, which is a long time stay there. The amount varies depending on the facility, but it is about maybe 50,000 yen to 80,000 yen. It's so expensive. This service type is mother spends only during the day. Mother can receive lunch or snack and is child care or breastfeeding support. The time spent is from 10 a.m. to 5 p.m. that evening. The amount varies independent, but starts about 15,000 yen. At last, outreach type home visit is a midwife can visit their home and provide service such as child care and breastfeeding support. The amount is about almost 1,000 yen one time. There are some difference in time and service depending on the facility. Postpartum care is available immediately after childbirth until the baby turns 1 year old. However, mother can only use this service no more than 7 times. My client also say that 7 times is less. We want more than that. Yeah, midwifery. My midwifery house specializes in visiting, and I had contracts with the 2 city hall. We talked about costs of use. Mother can use all type of care at cost of 10%. 90% of the burden will be borne by the city hall and Japan government. The price varies depends on the facility. And admission station, there are also postpartum care facility that are provided and 100% self-funded. It is a likely hotel, like a luxury. They get Astie or something. It's very expensive. It has not yet been rolled out throughout Japan. In some region, only one of the 3 types is offered. Japan government say that postpartum care service will be provided in all areas in this year. Now, I will talk about the actual midwifery care I provide to my client. We made a newborn visit, one family, where it was a 3-week postpartum. That couple were in their 30s. The baby is very healthy and gaining weight well. Mother doesn't look good. My mother's Edinburgh score is so high. The pressure, that is very high. Okay, I have a question for all of you. Why do you think this woman has a high score? Okay, I want to explain. Their situation is as follows. Parents felt the raising children to be more difficult than theirs imagined. Husband doesn't do housework. Wife takes care of baby and housework. She was so exhausted that she started crying. I'm sure you all think she should go back to her parents' house, right? However, many Japanese women cannot say that. I want to go back to home. This may seem strange to many of you. Wives who feel that their husband have taken child care leave and more considerate or duty of their husband. As a result, they don't say that want to go back home and end up working hard and housework and child care. I will adjust the relationship between this couple. By practicing my care during the 2-hour postpartum care, I stay their house. I listening carefully to mother's feelings. Mothers can feel better by having a midwife talk to them. She cried, but then after smiled. When I saw my mother smile, I adjust the relationship between this couple. I compared wife's role to her husband on her behalf. After that, she go back to parents' house with baby and spend the relaxation post-term period. Supporting a mother's post-term mental health can help prevent post-term depression and suicide. If this case had not been adjusted, the mother's stress would have increased. In addition, I'd like to introduce a specific example for postpartum care for my client. This photo is for baby parents of the main middle photo from Indonesia. The mother requested the baby massage. In my country, massage is done by mother for the formation of the attachment to their baby. However, last year I went to the International Conference of Midwife and visited 2 midwifery houses in Jakarta. I learned baby massage is performed by midwife and professional women. I put the knowledge to use. Thank you for the midwifery house in Jakarta. So lastly, take-home message. I think Indonesia large family is a very nice culture. It is very important and necessary environment for women's mental health. Cherish the beautiful culture raising child care together. That's all I have to say. I spoke as a midwife. I would be happy if you could convey the current situation in Japan. Thank you for your attention. Terima kasih banyak. Sampai jumpa lagi. That's all.
Thank you very much, Mrs. Taniguchi.
Thank you, Ms. Noriko and Ms. Haris. That was very interesting information and insightful for us. We'll see and we hear that there's a red line between what happened in Japan and what Ms. Haris drew before after the pregnancy, I think. So now we have some time for question from the audience. Please feel free to raise your hand or type your question in the chat box. If there is, I think we will start the question from the studio, right, Ms. Ira?
Yes.
Yes.
I believe there's one student. Could you please stand up?
Stand up, please.
Yes, and introduce yourself before you ask the questions. Thank you.
Okay. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. So let me introduce myself. I'm Kanita Salima. I'm a midwifery student from Gunadarma University. So I have a question to Mrs. Novi Marthiany Harris. What were some of the challenges Novi, Mrs. Harris, faced during her journey through postpartum psychosis?
Okay, maybe we will keep 3 questions before. Okay, there's one more over there. Yes. Oh, we have 2 students. Okay.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh. Good morning all. Ohayo gozaimasu. Thank you for all the audience and the moderator and all the speakers that here and give me a chance to ask my question. Okay, before that, let me introduce myself. My name is Anissa Raihani Kamto, and I'm a 6th semester midwifery student of Gunadarma University. My question is, how can postpartum care, including accommodation, day service, and home visits, contribute to preventing depression and supporting maternal mental health in Japan? Thank you, Mrs. Noriko. Arigato gozaimasu.
Thank you, Anissa. And one more from the other student from the left side.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, my name is Samara Naswa. I'm midwifery student for Gunadarma University. According to Ms. Novi M. Harris, what were the key factors that helped her in overcoming postpartum psychosis? Thank you.
Introduce yourself.
My name is Samara Naswa. Samara Naswa. Yeah.
Thank you, Samara.
Yes.
Maybe we will start to Mrs. Harris. Are you still there, Mrs. Harris? Hello.
Yes.
Yes.
I'm
okay.
here, but
yes.
The first question, I think I couldn't hear it clearly. What was the challenge of what? Can you?
of your resilience through the psychosis, depression. The most challenge that you face during your time, and how to be as good as now.
So, for me, like the most challenge is actually like the situation in terms of like the environment, because when I gave birth in the U.S., it's kind of like, I mean, I saw the presentation of Miss Noriko Taniguchi about in Japan. They have the what you call like postpartum visit from the midwife, But my most challenge is like United States, like a very individual, like culture. So it's like I was alone by myself, like that. That was very challenging. That's why my sister flew like 10,000 miles to help me. That was very challenging. That's the outside factor that is like very challenging. And in Texas also a very, very what you call like a car culture. You have to drive a car everywhere. And yeah, it's like I was not capable of driving car, and who's gonna help me? Like who's gonna help this thing? I was just thinking about there's a lot of challenge in terms of outside factor, but from the internal factor, this answer is also probably related to the other question about what is the key factor to become resilient. But this is the internal factor. Actually, I feel like if you want to recover, you have to admit the problem first, admit that you are sick, understand that you are sick, and not in denial. And once you admit, okay, I'm sick, that I need the treatment, and you have to commit after that. Because in my case, I came from a very skeptical, and mental health is not something, because it never affected me. But then I realized that, oh, wow, I didn't know until I felt it by myself, but once I admit it and not in denial that I was sick, I think and then commit to like taking medication and doing like exercise and everything that helps, that will be the key factor in, resilience, I think.
Thank you, Mrs. Novi. So this is also answer the third question about the key factor to overcome the postpartum psychosis, right? Or maybe you want to add something?
Yeah, I think that's the key factor. It's like inside yourself, like you have to, because I noticed that like I have this postpartum support international forum. Like a lot of them cannot recover, mostly because first the environment, like they were alone, like single mother, have to work, have to take care of a baby. That's like almost impossible to recover because nobody supports you. And that's the external factor. And the internal factor is the key factor, that you committed and the people have to support you. So it's within yourself and the support system. Both of them should work together.
Thank you very much.
Ms. Haris, I think what Ms. Haris said will be same condition in Japan, but in Japan the postpartum mom will have supporting from the midwife, because there's visiting home care, I think. Through the next question from for Ms. Noriko, how can postpartum care contribute to preventing depression and supporting mental health in Japan? To Ms. Noriko, please, to answer the question.
Okay. Could you explain one more time?
Okay.
Sorry.
Is the program that postpartum home care, that visiting in the postpartum mother, is that can contribute to prevent that depression or the mental health from the mother?
Okay.
Maybe Miss Ira will add something.
Do you need any
Yeah.
assistance? Because the student were asking, you have this program of postpartum care to the mother, and is it helpful for the mother to survive from mental health or to keep them safe
Okay.
from having a mental health condition?
Okay. This is my opinion. I think almost a mother is a difficult time until 4 months. Baby is 4 months, and then so they need care, constant care. But that is baby is still small, and then they don't know how to be feeling. They can't control the lifestyle, and then they need just on. And I think they need 4 months. If baby that grow up, they can go out, and then so all mother's feeling is change because meet outside friends or eat something food, different situation. Is that answer okay?
Yes. And also the program that you have in Japan about visiting the mother, is it very helpful in your experience to help mother to have the good mental health during their first months of having a child? Yes, it is. It is very helpful, right? So we can adapt this condition maybe, because as Ms. Harris said, that the insight and also the social support from our surrounding is very helpful for mothers to keep their mental health in a good condition. Yes. Okay, thank you to our great speakers, Ibu Novi and Ibu Noriko, for sharing their knowledge and wisdom with us today. Thank you to all participants for your active engagement. Let's continue this important insight and work towards a future where mental health is a priority for all, especially for mothers and children. And now let's welcome our dear Master of Ceremony, Dr. Astie, to take the time and get us to the next part of our program.
Ladies and gentlemen, please give a round of applause once again to our speakers and moderators from the first session. And before we proceed to the next session, we would like to extend our highest appreciation to our speakers who have come along, joining us all the way from Japan and also the United States. Please accept our token of appreciation that will be presented virtually by Ibu Rini Darmayantie, SST MPH, the Vice Dean of the Faculty of Pharmacy and Health Science Universitas Gunadarma. The first certificate will be presented to Ibu Novi Marthiany Haris. And please give a round of applause. Virtually, please accept our token of appreciation from Universitas Gunadarma. And our warmest gratitude, and we waiting you coming here to Indonesia and visit Universitas Gunadarma later on maybe. Okay. And the second certificate is presented to our second speakers, Ibu Noriko Taniguch. Thank you, Ibu Noriko. Warmest regards from Universitas Gunadarma, and we will wait you coming here to Indonesia, to Universitas Gunadarma later on. Thank you, and once again, our highest appreciation, once again, to the speakers who spare their valuable time and to share their expertise today. Arigatou gozaimasu. And distinguished guests, ladies and gentlemen, coming up next, we will still have 3 other speakers who is ready to delve more into the topics and sharing their insights within the context of, the mental health and the well-being of mothers and children in the modern era. But before that, please enjoy a performance by Academy Band with Gending Sriwijaya.
Dikala ku merindukan keluhuran dulu kala, ku tembangkan nyanyi lagu dari Gending Sriwijaya. Dalam seni ku nikmati bahagia Indonesia. Ku ciptakan kembali dari kandungan Mahagala. Sriwijaya dengan asrama agung Sang Mahaguru, tutur sabda Dharma Palasakya Kirti Dharma Kirti, berkumandang dari puncaknya si Guntang Mahameru, menaburkan tuntunan suci Gautama Buddha Sakti. Borobudur Candi Pusaka di zaman Sriwijaya, saksi luhur berdiri teguh kokoh sepanjang masa, memasyurkan Indonesia di daratan se-Asia, melambangkan keagungan sejarah nusa dan bangsa. Taman Sari berjenjangkan emas, Perlaksri Kesitra, dengan kalampu alam bagai di surga Indralaya. Taman Puji keturunan Maharaja Sailendra, mendengarkan iramanya lagu Gending Sriwijaya. Candi pusaka di zaman Sriwijaya, saksi luhur berdiri teguh kokoh sepanjang masa, memasyurkan Indonesia di daratan se-Asia, melambangkan keagungan sejarah nusa dan bangsa. Taman Sari berjenjangkan emas, perlaksri kesitra dengan kalam pualam bagai di surga Indralaya. Taman Puji keturunan Maharaja Sailendra, mendengarkan iramanya lagu Gending Sriwijaya.
Yeah. Ladies and gentlemen, we had a truly enriching first session, delving into the profound experience of postpartum psychosis and the important mental health services for mother and children. As we move forward, let's shift our focus to the broader realm of maternal and child mental health, exploring its significance in today's modern world. To guide us through this insightful discussion, we have through esteemed honor to welcome three discussing experts to our stage. First, we have Dr. Estu Lovita Pembayun, SST Magister Kebidanan from Universitas Gunadarma, who will enlighten us on the awareness of important maternal and child mental health. Next, we will have the privilege of hearing from Sadulloyeva Mahfuza Gaybulloyevna from Bukhara State University, who will share with us her expertise on mental health of mother and children in modern era, using Uzbekistan as an insightful example. Finally, to conclude our session, Boymurodova Nodirabegim Bahodir will guide us with her knowledge on the crucial topic of essential for mother to prioritize their own mental health. I'm certain that with this exceptional speaker at the helm, we are in a session packed with valuable insight, thought-provoking discussion, and practical takeaways. So, without further ado, let's extend a warm welcome to our esteemed speakers and embark this journey to exploring mental health of mother and children.
Without any further words, let us continue with an insightful presentation on awareness of the importance of maternal and child mental health by Dr. Estu Lovita Pembayun. She's the head of the study program from Gunadarma University. Before we give the stage to Dr. Pembayun, let's take a moment to acknowledge her remarkable background. And she holds a doctorate degree in psychology from Universitas Gunadarma, where she currently serves as a respected lecturer. Let us together see her CV. Let's extend a warm welcome to Dr. Estu Lovita Pembayun. Please take the next 20 minutes to share your insight with us.
Okay, thank you, Ibu Dr. Ira Puspitawati. Good morning, everyone. I hope you are all happy and healthy as always. The Honorable Rector of Gunadarma University, Professor Dr. E.S Margianti, SAMM, and the staff, and then all of the speakers on our seminars today from USA, Japan, and also Uzbekistan, and all of the participants. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera bagi kita semua. First of all, I would love to say thanks to God for this great opportunity for being here in this seminar. As we heard from our both speaker previously, we can get the point of view of the psychosis, postpartum psychosis survivor, Mrs. Novi Harris. Thank you for sharing with us today. And then also about the picture about how the implementation of the mental health services for mother and children in Japan from Bidan Noriko. Thank you so much. This all information today gives us an insight that this issue is very important. It's not just as simple as hormonal changes and so on. It's involves lots of factors, so that I'm just going to emphasize that it is very important and it is need to be our concern, especially as a midwife. Okay, in this session, I would love to discuss about the awareness of maternal mental health issues, the role of midwives. Well, if we talk about the health, according to World Health Organization, health is a state of complete physical, mental, social well-being, and not merely the absence of disease or infirmity. From this definition, it has an implications that the mental health is not just about the absence of the mental disorder or mental disability, but it's a state of well-being where in which individual realize about their abilities and then how they can cope with the normal stress on their daily life, and then also how they can work productively and make a contribution to their community. There are many different types of mental disorder, and sometimes it's also referred to mental health conditions. But the latter is a broader term covering mental disorder, then psychosocial disability and mental states associated with significant distress, impairment in functioning, or risk of self-harm. According to the data from WHO, in 2022, due to the COVID-19 pandemic, there are and the number of people living with the anxiety and depressive disorder rose significantly. Initial estimate shows that 26% increase for the anxiety and 28% for the major depressive disorder in just 1 year. Okay, why this mental health has become important? Because it has the intrinsic and instrumental value that helping us to connect, function, cope, and thrive. Connect means that we have how we have to, positive relations with others, contribute to the community, and get a sense of belonging and empathize with others. And then the value of a cope is how we deal with our daily normal stresses and adapt to change, maybe I'm going to highlight this one, adapt to change, because of nowadays in this modern era, the information and communication technology is growing so fast and so rapid, so that people try to catch it up. So sometimes they get overwhelmed. And it's also happened to mothers, and with, especially with the social media, it's very easier for them to get low esteem, low self-esteem, and then they feel like they are not as succeed as any other parents or any other mothers in develop the positive parenting. So they get distress and frustration. And then the function of the value of function is apply cognitive skills and then gain an education, earn a living, make healthy choices, and learn new skills. And the last is the value of thrive, where we realize our own abilities and how we're feeling good about ourselves, about others, and about everything, and how we found the purpose in life, and think about our well-being and that of others. Okay, is there a little jam with, okay. Sorry. Okay. If there's some, find some imbalance with those values, then we will face the mental health problems. As we see nowadays, maybe from the TV or maybe from the internet, or maybe in our daily lives, there are such a bullying case, bullying amongst students, maybe, and then the violence, especially against women and child, and then aggressivity, hostility, low self-esteem, emotional, and then self-harm, and even a suicide. So this mental health problem will create or will lead to a vicious cycle that affect also with poverty, that will exacerbate the mental health conditions. So people will, this mental condition will be have difficult to earn a living, so they get poor, and this poverty is put them even deeper into this mental ill health. So to overcome all of that, the WHO has set the Comprehensive Mental Health Action Plan in 2013 to 2030, where the first objective is to strengthen the effective leadership and the government for mental health. And then the second objective is to provide the comprehensive, integrated, and responsive mental health, social care services in community-based setting. And the third objective is how to implement the strategies for promotion and prevention in mental health. And the fourth is about the strength and the information systems, evidence, and research for mental health. This third objective, I guess it can be our field as a midwife to give a little contribution to overcome these maternal mental health issues. As we work with the woman throughout her life cycles, from the infancy, toddler, and then the adolescence, and then the reproductive age until elderly, then we can work from the infancy to toddler and on the reproductive age as the motherhood and the childhood period. This is the recently data from BKKBN in 2024. It's some kind of a bureau of deal with the national populations and family planning in Indonesia. It says that 57% mothers in Indonesia experience baby blues symptoms, and it makes Indonesia have the highest cases of the baby blues in Asia. Why the baby blues is being important? Because it can develop to postpartum depression or even more postpartum psychosis, like what Mrs. Harris shared with us today. So it is really, really important, especially for us as a midwife, to conduct the early detection so that we can prevent this baby blues is developed to postpartum depression. Because this postpartum depression will develop to negative parenting, and so it will cause the child abuse and neglect. From many other journals about the child abuse, it says that this is a journal from Caroline Green and et al. And then many others research from Dixon and Hamilton and Scaramella. It shows that the mother who had experienced some form of abuse during their lifetime were more likely to engage in negative response and abusive behavior toward their children than mothers who didn't. So it's in line with as the midwifery philosophy captures the idea that midwifery care is holistic, so it will include the social, emotional, cultural, and then spiritual and psychological, and also, of course, physical experiences of the woman. So we, as a midwife, we're trying to develop the positive experience for the mother during the antepartum, intrapartum, and postpartum, so that the mother will be ready, will be well prepared for the childbearing and motherhood, so they can develop the more positive parenting to their children. Okay, for the last, I think I'm just gonna highlight the role of midwife. This is very important for us so that we can overcome these maternal mental health issues. First is about the focus assessment, about the early detection, so that how we assess risk factor and at-risk behavior, and then also assess mood and then feelings about motherhood. Because nowadays, I think it is very rare for us to assess about the moods and feelings, because sometimes we just think, oh, it's okay if the baby is healthy, the mother is healthy, and that's it. We sometimes forget to assess the mood and the feelings. And then the second role is formal social support. So we can be one of the women's social support. Like Mrs. Harris says, that a little help is matter. It's matter to a new mother, especially a new mother. And we can be one of these support as a formal social support who have competency and legal authority. And the last is, I think we need to strengthen the interprofessional collaborations to follow up the findings on our early detections if there is some indication to the postpartum depression, so that they can have the treatment like Mrs. Harris, the appropriate treatment from either the psychologist or the psychiatric for further treatment. Okay, I think that's all that I can share today. I hope it will give us an insight to strengthen the early detection, especially how we use or we access the Edinburgh postnatal depression scale that I think it's not, it's very rare. I never found that the midwife access the scale for early detection. I hope it will be our concern next to overcoming these maternal mental health issues. Okay, thank you, everyone. Have a great day, and I will back to our moderator. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Ms. Estu Lovita, for sharing your incredibly informative. I'm sure your insight will resonate deeply with our audience. I know our viewers on UGTV and participants in Zoom room are eager to engage with you further, but just hold off the question because we're gonna now transition to our next speakers, Ms. Sadulloyeva Mahfuza Gaybulloyevna, that will bring us to Uzbekistan. Hi, Ms. Sadulloyeva, are you available in Zoom room?
Good morning, ladies and gentlemen. Good morning, all of our friends. My name is Sadulloyeva Mahfuza Gaybulloyevna. I am lecturer of the Bukhara State University, and I am glad to see all of you.
Yeah, nice to meet you, Ms. Sadulloyeva. Today we will share with us about the mental health of mother and children in the modern world using example of Uzbekistan. Before we delve into Ms. Sadulloyeva's insightful presentation, let's take a moment to familiarize ourselves with her impressive background and expertise by taking a look on her CV.
Oh, naman. Naman nga perdunya.
With further ado, let's give a warm welcome to our esteemed speaker, Ms. Sadulloyeva Mahfuza Gaybulloyevna. The time is yours. Please take the next 20 minutes to give us the presentation.
Okay, thank you very much. Can you see my presentation?
We're not seeing clearly right now.
And now, is it clear?
Yeah, it's clear.
Okay, thank you. And today we will talk about mental health of mothers and children in the modern world using example of Uzbekistan. And we will today talk, and I would like to address a critical issue that affects families globally and is especially pertinent in our beloved Uzbekistan, the mental health of mothers and children in the modern world. In recent years, Uzbekistan had made significant strides in improving health care education, and social self-care. However, the rapid rate of change and the pressures of modern life have brought new challenges, particularly concerning mental health. It's essential that we understand and address this challenge to ensure the well-being of our mothers and children, the very foundation of our society. Firstly, let's consider the mental health of mothers. In Uzbekistan, as in many other countries, mothers play a central role in the family. They are often the primary caregivers, balancing work, household responsibilities, and childcare. This multi-faceted role, while fulfilling, can also be incredibly demanding. The pressure to meet society expectation, complete with limited access, the mental health sources can lead to stress, depression. Studies have shown that postpartum depression affects a significant number of new mothers, yet it remains underdiagnosed and treated in many cases. To address this, we must advocate for comprehensive mental health services that are accessible and culturally sensitive. This includes training healthcare professionals to recognize and treat mental health issues, providing support groups and raising public awareness to reduce the stigma associated with mental illness. By creating a supportive environment, we can improve mothers to seek help and prioritize their mental well-being. Now let us turn our attention to the mental health of children. Childhood is a critical period for emotional and psychological development. In Uzbekistan, children are increasingly exposed to the pressures of academic achievement, social media, and rapid societal challenges. These factors can contribute to depression and other mental health issues. Moreover, the COVID-19 pandemic has exacerbated the challenge, disrupting education and social interacting. Here are some key points highlighting the significance of mental health for mothers and children. The first of them is maternal mental health. The second is child mental health. The third is interconnectedness. The fourth is invention and support. And the last, we will talk about all of them. The first, maternal mental health. A mother's mental health significantly impacts her ability to care for her children. Maternal mental health issues such as postpartum depression can affect bonding with the child, leading the long-term consequence on the child's emotional development. Addressing maternal mental health is essential for creating a nurturing and supportive environment for children to thrive in. When mothers are mentally healthy, they can prove the necessary care, love, and supporting. Child mental health. Children's mental health is closely linked to their mother's mental well-being. A mother's mental health can influence a child's emotional stability, behavior, and cognitive development. Early childhood experience have a profound impact on the child's mental health throughout their life. Positive interaction with a mental health mother can foster realistic self-esteem and emotional intelligence in children. Next, we will talk about interconnectedness. The mental health of mothers and children is interconnected. A mother who prioritizes her mental well-being sets a positive example for her children, teaching them the importance of self-care and emotional regulation. Supporting maternal mental health can create a ripple effects, benefiting not just the mother and child, but the entire family unit. Healthy maternal mental health practice contribute to a harmonious family environment where open communication and emotional support are valued. Invitation and support. Early invitation and support for maternal mental health issues are crucial for preventing adverse outcomes for both mothers and child. Access to mental health services and social support can help mothers navigate the challenge of motherhood effectively. Investing in programs that promote maternal mental health can yield long-term benefit by reducing the risk of mental health issues in children and promoting healthy family dynamic. Harmonization of family relationships, increased responsibility for one's own healthy and the health of the fetus, and the ability of independently apply relaxation techniques significantly improves the quality of life of pregnant women. Principles of instilling healthy skills in the mother and baby. And there are some examples, and all of them I will not say you can see there some of them, hardening, and you can see education of healthy habits and skills from early childhood. Today, there are 10 public specialized scientific and practical medical science-based recognized scientific schools, where complex are highly qualified. professionally trained personnel who provision of high-tech medical service and at a modern level equipped. It operates in almost all areas of Uzbekistan, perinatal, cultivator centers of mother and child. All pregnant women in rural areas using funds from the state but get transmit by multivitamins, plates for forms healthy. In conclusion, prioritizing the mental health of mothers and children is essential for building strong, resilient families. By recognizing the interconnectedness of maternal and child mental health and providing support the research, we can create a nurturing environment where both mothers and children can thrive emotionally, socially, and psychologically. On this note, I would like to conclude my speech. Thank you for your attention.
Give the applause for Mrs. Sadulloyeva. Yes. Thank you, Mrs. Sadulloyeva, for sharing your incredibly informative. I'm sure your insights have resonated with our audience here. I know our viewers on UGTV and participants in the Zoom room are eager to engage with you further, but let's hold on for the questions for now as we move to our next speaker, Mrs. Boymurodova Nodirabegim Bahodir. She will share her expertise on the essentials for mothers to prioritize their own mental health. Before we continue, let's take a moment to familiarize ourselves with her impressive background and expertise by taking a brief look at her CV. Without any further words, let's give a warm welcome to our speaker, Mrs. Boymurodova Nodirabegim Bahodir. The time is yours. Please take the next 20 minutes to share your insight with us. Thank you.
Thank you. Good morning, dear lecturers and listeners. My
Or sound. Hello, can you hear me? Mrs. Boymurodova? We cannot hear your sound yet. Maybe there's some problem with the speaker. Could you have a look, take a look for the sound? For the sound?
Okay. Uçurdun mu ağzını?
Hello, could you test the
Dear,
sound?
Boymurodova have some problems with her leptin. That's why I advise her to my home, and she's with me. And if you let her, she will continue her lecture for my leptin. Can you help us? Can you add us to do it?
Yes, excuse me, from the Zoom.
There are some problems with your leptin. Come
Yes.
here, Nodirabegim. Thank you very much. Just a minute, please.
It's okay, Miss. And we are fortunate because you're in the same room with Mrs. Boymurodova, so we can have fixed with the sound.
Yes, she has some problem with her leptin,
Yes,
and
that's
she
right.
have not opportunity to speak, and that's why I want to help you. Just a minute, please.
Yes.
Okay, thank you for being understandable. 7. You can continue, Nodirabegim.
Okay. Excuse me. Good morning, dear lecturers and students.
Good morning. Okay, thank you, Ms. Boymurodova. We can continue with the presentation.
Okay. I'm honored to have the opportunity to speak on such a crucial topic today, one that affects the core of our society, the mental health and well-being of mothers and children in the modern era. In our fast-paced, interconnected world, the demands on mothers have increased exponentially, juggling careers, household responsibilities, and the emotional needs of their children can often leave mothers feeling overwhelmed and depleted. In the midst of this whirlwind, it is easy for self-care to fall by the wayside. However, as the saying goes, you can't pour from an empty cup. It is essential for mothers to prioritize their own mental health and well-being in order to effectively care for their children. Similarly, children today face a unique set of challenges that can impact their mental health, from academic pressure to social media influence, and the expectations placed on them can be immense. Moreover, the modern era has introduced unprecedented levels of screen time and digital distraction, which can hinder the development of crucial coping skills and emotional resilience. Prioritizing mental health is crucial for mothers, given their central role in the family and the numerous demands they face. Here are the essential points for mothers to prioritize their own mental health. Firstly, acknowledge and accept emotions. Recognize that it is normal to experience a range of emotions, including stress and anxiety. Accepting these feelings without judgment is the first step forward addressing them. Secondly, seek professional help. Don't hesitate to reach out to mental health professionals such as therapists or counselors for support. Professional guidance can provide valuable coping strategies and emotional support. Establish a support network. Build and maintain a strong support system of friends, family, and community groups. Sharing experiences and receiving support from others can significantly reduce feelings of isolation. Practice self-care. Dedicate time for self-care activities that rejuvenate you, such as reading, exercise, hobbies, or relaxation techniques like yoga and meditation. Regular self-care helps reduce stress and improve overall well-being. Set boundaries. Learn to say no and set boundaries to avoid overcommitting. Protecting your time and energy is essential for maintaining mental health. And maintain physical health. Regular physical activity, a balanced diet, and adequate sleep are fundamental to mental well-being. Physical health and mental health are closely linked. Educate yourself and gain knowledge about mental health and wellness. Understanding common issues and effective coping strategies and empower you to manage your mental health better. And communicate openly. Talk about your feelings and experiences with trusted individuals. Open communication can help relieve stress and foster understanding and support. And mindfulness and relaxation techniques. Engage in mindfulness practices and relaxation techniques such as deep breathing exercise, progressive muscle relaxation, or guided imagery to manage stress effectively. And balances work and personal life. Strive for a healthy balance between work responsibilities and personal life. Flexibility and realistic expectations are key to reducing stress and preventing burnout. And focus on positive relations. Surround yourself with positive and supportive people. Healthy relationships can provide emotional stability and enhance your mental health. Regularly assess your mental health status. Reflect on your feeling and any sign of stress or anxiety. Early detection of issues can lead to timely intervention. By prioritizing these points, mothers can better manage their mental health, ultimately benefiting their well-being and the well-being of their families. So how can we maintain balance in the midst of these pressures? Firstly, by recognizing the importance of self-care for both mothers and children. This includes setting boundaries, prioritizing sleep, and engaging in regular physical activity and practicing mindfulness techniques. Secondly, fostering open communication within families is paramount. Creating a safe space where mothers and children feel comfortable expressing their emotions and concern can go a long way promoting mental well-being. Thirdly, seeking support when needed is not a sign of weakness, but rather a sign of strength. whether it is through therapy support groups or reaching out to trusted friends and family members. It is crucial for mothers and children now that they are not alone in their struggles. Lastly, let's not forget the importance of community. Building a support network of fellow mothers and like-minded individuals can provide invaluable resources and solidarity in navigating the challenges of modern parenthood. In conclusion, maintaining balance in the mental health and well-being of mothers and children in the modern era is a multifaceted endeavor that requires intentionality, compassion, and support. By prioritizing self-care, fostering open communication, seeking support when needed, and building community, we can create a healthier and more resilient future for generations to come. Thank you for attention, lecturers and listeners.
Thank you very much, Mrs. Boymurodova Nodirabegim. Let's give a big hand for her. Actually, today's session has provided a powerful exploration of the crucial link between maternal and child mental health. But before we continue to the question and answer session, let's take a moment to appreciate the power of music and its ability to connect us on an emotional level. Welcome Academy Band with the song Maluku Kie Reha.
Ma foto-foto ternate bacan Tidore sejauh lolo marimo ngone futuro marunga lamo ternate baru kukira yo ma foto-foto ternate bacan Tidore sejauh lolo marimo ingone futuro marunga lamo ternate Usamo teraisa Vilonga ipatingara Usamo teraue Maitara jagangara Usamo tedakutara Kie hirima lili Sebagam sitohida Bubane Ternate jang following Baru kukira Yo ma foto-foto Ternate bacan Tidore sejauh lolo Marimor ngone futuro Maronga lamo ternate Usamo teraisa Ilonga ipatingara Usamo teraiye Maitara jagangara Usamo tedakutara Kie hirima lili Sebagam sitohida Bubane Ternate jang following Usamo teraisa Ilonga ifatingara Usamo teraisa samoteda kutara kie hirima lili sebagam sitohida bubane ternate jam foloi ternate jam foloi ternate jam foloi.
Welcome back, valuable UGTV viewers and the esteemed participants from this international midwifery seminar. I'm certain that after the insightful presentation from our three esteemed speakers in the second session, your mind will be mind are brimming with questions and inquiries, right? Now it's your chance to engage with our experts and gain further clarity on the crucial topics of maternal and mental health. Without further ado, let's dive to the next session, which is question and answer session, and embark a journey of deeper understanding and knowledge. Remember, there is no question was too small or too big. Just feel free to ask everything that's on your mind, and our speaker will be delighted to address your inquiries with their expertise and passion. Feel free to raise your hand for the audience in the studio, and for the audience in the Zoom room, please chat your question in the chat box, and then our speaker will be delighted to answer the question and share their perspective from this topic.
We'll start with our audience in the auditorium. Maybe there are some participants who will ask. Okay, yes, thank you. And please introduce yourself before you deliver your question. Thank you.
Okay, Assalamualaikum warahmatullahi wabarakatuh. I would like to ask to Miss Estu. I am Adela Shiva. I'm a student at Gunadarma University from the Midwifery study program. I want to ask you, seeing the high rate of the baby blues in Indonesia, is there a program or community that can help reduce the high percentage of baby blues in Indonesia? That's it. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
So before you answer, maybe we continue because I saw there's a participant who already raising her hand. Yes, please.
Bismillahirrahmanirrahim. Good morning, all. Before that, thank you to all of audience, moderator, and all of the speakers that give me a chance to ask my question. Before that, let me to introduce myself. My name is Astie, and I'm from 6th semester of midwifery student of Gunadarma University. I want to ask to Miss Boymurodova. My question is, what are some of the best ways to support the mental health and well-being of mother and children in the modern era? Thank you.
Okay, maybe, one more question at the back. Maybe, from the student. Okay.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Thanks for the time. Let me introduce myself. My name is Afifah Taufik. Now I'm a midwifery student, currently in 6th semester. I was very excited to attend this seminar. I get new insight and mindset for this seminar. However, there are several things that I highlight. Is currently, if you look of the development, the modern era, the choice of delivery by section cesarean is also increasing. Then, will the choice of delivery by section cesarean also have an impact for the mental state of the mother? what can we do as the midwife? That's all. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Ibu Estu, Dr. Estu, do you want to begin with the answer?
Okay, thank you, Ibu Dr. Ira. Okay, thank you, Ibu Dr. Ira. I'm sorry, I can't hear clearly the first question.
Is there any community that help post-power depression?
Okay, thank you. The community, right? I think in this modern era, where the Internet of Things, AI, and then the information and communication technology growing so fast and rapid, and also the media, social media, help us to gather a community for helping mother. For what I know, as far as I know, there are lots of community in social media, such as maybe Facebook, Instagram, and Twitter maybe. There are lots of communities that with the different topics from the about the breastfeeding, how to support a mother to exclusive breastfeeding, and then also maybe maybe Liana ever heard about this community about the depression mother or baby blues?
I think maybe about the community for supporting depression postpartum. Ever heard once? There's maybe a lot of communities that I don't know, but as far as I know one supporting group that is commonly supporting the mother who have, especially single mother, with have sexual reproductive mental health issue that affected to the process the mother to maintain the kids maybe gitu.
Okay, because Liana is a practitioner. She's a midwife, and she also dealing with something like that in reproductive health, especially with violence against women and children. So I think there are lots of communities, and especially in this social media era, maybe can find also the hotlines maybe that the government have already set for some kind of mental health problem. And right nowadays, I think the government is also pay attention more for this mental health issue, not just about the mother, but it's a mental health issue as a whole. I think that is Ibu Ira.
It answer your question. And we move to Mrs. Boymurodova. Hello, are you still there?
For your questions,
yes.
I think
yes. There's a question about what are the best way to support mental health for mothers. Please explain to us. Thank you.
Okay, I think the best way to maintain mental health is yoga and meditation. As I mentioned earlier, yoga can help so maintain physical and psychological health too, and it is the cheapest way, I think. Thank you.
Thank you. Maybe in your personal experience, is there anything that we have to pay attention more to the mental health status of the mothers? I think it's all because you already know. Yes. Is there anything else that we have to pay attention to?
Can I help you to answer
of course.
the question? You know, we are lecturers, and from morning till evening we are at the university, and we have not got opportunity to have some physical or another exercises, but as all of women, we have some jobs at home, and sometimes we go to do some psychological or physical exercises to как будет эти тренировки?
Training.
To train.
Yes, thank you very much. So it's kind of best solution for everyday's life. And maybe we can move to the third question. Mrs. Liana, can you help me with the third question?
The next question is about choosing delivering way that is affected for mental health for the mother. Is that correct? Yes. The question will be
Answer this question, the best way to deliver a baby to keep the mental health.
Yes.
My opinion, I think the mother have the same potential to develop the baby blues or postpartum depression. There is, as far as I know, there is no evidence yet. Maybe it can be our topic to research. Is there any difference if the mother choose sexual cesarean or they choose to normal vaginal birth? Is there any difference in develop the baby blues or postpartum depression? But so far, we have to always put the mother in the same risk. Either it's sexual cesarean or it's normal vaginal delivery. We have to give more pay attention because as I see in the daily practice in the TPMB or Puskesmas hospital, sometimes a midwife is too focused on the biological aspects. Sometimes they get into the word and menyapa, what we should menyapa, what we call menyapa ibu. We ask, we say hello to the mother, and then sometimes we just ask about how are you? Is the bleeding stopped? Is there any pain? How is the baby? Is he breathe normally? Or how about the breastfeeding? And so on. But sometimes we forgot to ask about how is your feeling today? Are you feeling sad? Are you feeling happy? Are you feeling depressed or something like that? Maybe we learned from Japan back then from Bidan Noriko. She periodically asked the mother to filling the questionnaire, the Edinburgh postnatal depression scale, EPDS. She's doing that periodically to week by week to see is there any potential risk to develop into maybe there is a baby blues or maybe postpartum depression either. That's right, yes.
Yes, I think it's a very great opportunity for the midwifery study program to start the research on this area.
Yes, right. It's an interesting topic.
Yes, that's right. Maybe we have some questions too from the chat box, from the Zoom room participants. Okay. Could you help me?
This is addressed to Mrs. Boymurodova. from Kashafiani, University of Gunadarma. Why is it important for mother to establish a support network and practice self-care based on the information provided in the paper? Please, Ms. Boymurodova, could you answer the question? Ms. Boymurodova, are you available?
Maybe while we are waiting for the connection, maybe we can move for the next question first.
Okay.
For the next question, maybe. Okay. This is for Mrs. Sadulloyeva. I hope her connection is good too because they're in the same room. What are some strategies mentioned in the paper for mothers to effectively care for their children by managing their mental health? Is there any question for Dr. Estu? Maybe she can answer the question while waiting for the connection.
I think maybe the connection.
First of all,
okay, thank you. So you're still in?
Okay.
Okay.
Yeah, I'm here, but Boymurodova is not here. Unfortunately, she has got two boys, and she ought to go to kindergarten. That's why she's not here. And excuse me, maybe I will answer for the questions. And the first question was about what? Can you
represent the question
again? Can you
again?
repeat the question about establish? Why is it important for mothers to establish a support network and practice self-care based on the information provided in the paper? Unfortunately, I don't know what she prepared to our this lecture, but how can I understand? I will explain this. I think that in our modern area, in the 21st century, all of us in Uzbekistan, in Indonesia, in Japan, in USA, the modern woman is a woman who can or ought to do everything. She must be very good wife. She must be very good mother, and it's not. She must be very good работник, worker, and it's, I think, not easy to do and to prepare all of this, and that's why I think that in modern century. All of us must to do everything. How can we understand and how can we do it? Of course, it's my opinion, and excuse me if I have some mistakes in my speech.
Okay, thank you. I hope it can answer the question. And it is also the question for the second, or we should represent the second question?
And what was the second question? Can you repeat it? Excuse me.
Okay.
What are some strategies mentioned in the paper of mothers to effective care for their children by managing the mental health? Okay, thank you for the question. And I think the first is to be not selfish. I think it's the first and the main fact when all of mothers, they must to be very community. They must take care of their children, and they can support their family area. Не надо мне это, я своими словами. Правильно говорю же? And this, I think, includes training health care when all of members of the family can support each other, and supporting each other, not only mothers caring, but all of members of this family. You know, in Uzbekistan, we have got not little families. Our families are big. There are some of each members, mother-in-law, father-in-law, wife, husband, children, and another members, uncle, aunts, and all of them live in one very friendly family. That's why supporting and helping each other, it's very it's very crucial, I think. Thank you for your question.
Thank you. So we're lucky that we live in the life that full of social support, like you said. Like in Indonesia, we have the same condition too. I saw there's one participant in the room that has raised her hand to ask for a question. Is there anyone else? Okay, yes, thank you.
Thank you. Assalamualaikum warahmatullahi wabarakatuh. My name is Anis Arfia from student midwifery Gunadarma University. My question to Ms. Estu. This question is related to interprofessional collaboration. Is there still any change for other professionals? Apart from psychologists or psychiatrists, to get involved in overcoming maternal mental health issues. Thank you.
Okay, I can answer it directly, Ibu Ira?
Please.
I think, okay. The interprofessional collaborations is, I think, for this maternal mental health issues is widely open. Of course, the main professional that we should collaborate is with the psychology and psychiatrists also. But any other professional maybe could collaborate in other ways because this modern era, the social media or maybe we can build some application maybe or tools to assess about the early detection, help us to how we can make the early detection in adequate ways so that maybe we can collaborate with the communication fields or maybe also the information and communication technology and many other professional, I think. Maybe we have also knows that there is a digital APDS, so that maybe we can introduce to the mother to make a self-assessment first from the website. And maybe we can develop any other tools that will help the mother to the self-assess or any other applications, especially for the promotion and prevent to strengthen one of the strategy of the promotion and the prevention, so that maybe we can build also the media to delivering or involve to delivering the psychoeducation about this awareness of the mental health issue, especially for the mother. That's all I guess.
Thank you, Dr. Estu. We continue because there are still lots of questions in the Zoom room, I think. Can we continue to the Zoom room? Yes. I hope Mrs. Sadulloyeva is still present in the Zoom room. This is a question for you. Why is maternal mental health considered a critical issue in Uzbekistan, and how does it impact the well-being of children? And the second question is, what are some key factors highlighted that can promote mental well-being for mothers and children in Uzbekistan? This question from Dinda. Mrs. Sadulloyeva, are you still present in the Zoom room?
Yes, I'm here.
Yes, can you see the question on the screen?
Yes, the question is, why is maternal mental health considered a critical issue in Uzbekistan, and how does it impact the well-being of children? I want to correct the question because I think that maternal mental not in Uzbekistan, but all in the world, is impact, I think, because when you get up every morning and when you prepare some dishes for your family and the breakfast, if you are today, it's very well, if you are happy, if you are friendly, this emotion, its impact to other members of the family. Are you or no? I think all of members in the world, all of people in the world, the impact mother's main well-being, its impact to all of them, and include Uzbekistan, because mother is the first member of family who ought to or to raise their sons, their daughters, and she has, the woman, she has impact to their rising, to their being better, and of course it's include not only to give something, to prepare them something. No, I think it's include to be understandable when you support your children in the psychology or physical beginners.
Thank you. And for the second question.
What was it? Can I?
Okay. Can we?
Yes. What are some key factors highlighted that can promote mental well-being for mother and children? In my opinion, most important factors are midwifery, health care centers, co-workers support, and also family support. It would answer the first question. I think it's continued. And in addition, I can say self-care awareness. I think I have to know how to manage with depression too. I have got many books at my home, and I think that people must read more. In our 21st century, our teenagers don't like to read more. They love to be online. They have their mobile, and they think that it's very cool. But I think it's not it's not right. I think that they must to read more. Thank you very much.
And is there any more questions from the Zoom room? Maybe I ask the committee. Yes? Okay. Can we look at the question, please? I think although Mrs. Mahfuza is not present, but maybe Mrs. Sadulloyeva will answer the question. It is from Sifa Diviana. I'm currently working on my thesis. The title is Psychological Well-Being in Mothers Who Have Children with BPD. Maybe you... can we connect directly to Sifa Diviana? Maybe she will explain about the BPD. Is there a difference between psychological well-being in mothers who have children with other special needs when compared to those who have children with BPD? In Indonesia nowadays, BPD cases are rarely detected, but I have my subject here that facing problem with her child that have BPD. Can you give me Indonesian mother with the same condition some advice of how to handling children with special needs, especially personality disorder like BPD? For the committee, maybe we can directly speak with Sifa Diviana.
Reactive boğuluk sindromu.
Sorry, committee, we can talk directly with Sifa. Is it possible?
What does it mean, BPD?
Yes, we were asking the same thing.
I didn't understand. Я не поняла. I didn't understand. I have not idea because I didn't know what does it mean.
Yes, we will wait for a while so we can talk directly to Sifa.
Okay, sorry, can you hear me?
Sifa is already present, Mrs. Sadulloyeva. Can you hear her?
Yes, I hear, but can you, good morning. Thank you for your very interesting question. But excuse me, but I don't understand what does it mean, BPD?
Hello, Sifa. Can you hear us? Yeah, maybe you can directly describe what the BPD is.
Okay, I'm sorry. It's my headset was having a problem. So, the BPD is referring to the borderline personality disorder, which is very, very rare at Indonesia right now to detect. Maybe there's more of people that have borderline personality disorder, but I don't know, maybe they're not checked to the psychologist or something like that. It refers to borderline personality disorder. Simple. Sum up. Thank you.
Okay, so it is borderline personality disorder. Is it with the child?
Yeah.
It happened to the child.
Yeah, happened to the child. It's more like the child is 18 years old right
Okay.
now.
And the mother is
Oh,
having
and
trouble because she have a BPD child. Is that true? The question is like that?
yes,
Ah, okay. Maybe
yes,
there is
correct.
some,
Yes,
okay.
exactly.
I'm sorry,
Thank you.
Mrs. Sadulloyeva.
I'm here, but unfortunately I don't understand what am I talk about. I don't know what I must talk because I don't know BBT. I don't understand. Excuse me. In Uzbekistan, we have not got maybe some problems with this. That's why I didn't understand. I don't know what to answer here. Maybe some problems with their psychology, maybe some
Yes.
problems with their physiologic,
It is
maybe
with
some problems with
psychological
their
condition.
character.
It is with psychological condition. Maybe it's connected to the condition where someone is not having a very clear condition when they're happy and when they're sad, I think, about the borderline personality. Yes.
Okay. Okay. I think that I think maybe my answer it will not be full answer, but I will постараюсь.
I will try.
I will try to answer to this for this question. I think that in our area, in our modern area, our teenagers are not power as we. I'm 44 years old, and in my life, I saw many situations when try to do something worse than it's now. But I think our teenagers now are not power as we. The first it. The second, I think that to be power is not a real area. It's not real impacting. I think teenagers must improve themselves. How can they do this? To be happy, it's not only have not empty not empty wallet or some problems with the teenagers. I think it's to be happy. It's when you have the first all of your members, mother and father. In Uzbekistan, it's better. You have mother, you have a grandmother and grandfather and uncle, aunts. They all time support you to be happy. Because in Uzbekistan, as I told, all of members ought to support the child. They want to give everything. Their gifts, not only money or some presents, their gifts are supporting and helping. Because depression is the first problem in modern area. It's a very good question. I understand now it. I understood. Excuse me. To be unhappily or happiness, it's when nobody in your around they did not understand you, and the reason it because the child didn't understand them. Of course, it's my opinion. The child is very selfish now. They want everything for them. Everything. It can be clothes, it can be dishes, it can be school, another things. But it's not good to be selfish, I think. When we are not selfish, we can see how can we help others. For example, we know many, we like to watch TV, and there are many movies when brothers supporting their little brothers, when daughters supporting their little sisters, and another examples. They do this because they want to help them. They are not selfish. I think to be happy, it's not to be selfish. And it's my answer.
Thank you very much. It's not an easy question, but you answer it very well. So maybe this is the end of our session. Ibu Liana, could you continue?
Ira, and to all our speakers today and all the participants that very enthusiastic about the seminar today. Today's seminar has embarked our powerful journey exploring the interact and vital connection between maternal and child mental health. We begin by raising awareness. As we leave this session, let these key takeaways guide us, which is awareness is a key, global challenge, local solution and support is a must. Prioritizing mother well-being will be making happy mothers. Happy mothers will be make happy family, and happy family will be make a happy child. By fostering open dialogue, prioritizing early intervention and advocating for accessible mental health service for mother and children, we can create a world where all individuals, regardless of age or background, have the opportunity to thrive. Thank you once again to our esteemed speakers, to Ms. Estu that having here with us in stage, for sharing their knowledge and inspiring perspective. This concludes our seminar. Would like to thanks also to your participant in today's seminar. We hope you find it informative and engaging today. Now, let's back to our esteemed MC, Ms. Astie, to take the time and guide us to the next part of this session.
Okay, please give a round of applause to our moderator and speakers today. What a very insightful session, and we would also like to express our highest appreciation to all the speakers and moderator for their valuable time and share their expertise today. And we would like to present our appreciation will be presented by Ibu Nina Herlina SSIT Bidan, Magister Kesehatan, the head of Midwifery Study Program at Universitas Gunadarma. The first certificate will be presented to Dr. Estu Lovita Pembayun, SST Magister Kebidanan. Please give a round of applause. I think we still have just a moment, we still have a trouble in technical. So the first certificate will be given to Ibu Dr. Estu Lovita Pembayun as one of our speakers today. Thank you, Ibu, for your time. And the second certificate will be presented to Sadulloyeva Mahfuza Gaybulloyevna. Sorry for the misspoken of the name, misspelled. Thank you for your time. Our warmest greeting from Universitas Gunadarma, and we are looking forward to greet you in person sometime in the future in Gunadarma, Indonesia. Thank you. And next certificate will be presented to Boymurodova Nodirabegim Bahodir Kizi, who is unfortunately didn't make it to to accept our certificate, but here we are. So I think, okay, Bu Nina. So this one is for Boymurodova Nodirabegim Bahodir Kizi as the speaker. Thank you for your time. And the next one is it's also for our remarkable moderator. The first one is presented to Dr. Ira Puspitawati, Magister Psikologi Psikolog. Please give a round of applause to Ibu Dr. Ira. Yes, now we can see the certificate. Please give another great round of applause, please. And the last but not least, the certificate to other moderator, Ibu Liana Elfaristo, Sarjana Sains Terapan, Magister Kebidanan. Okay, thank you Ibu Nina Helena for presenting our token of appreciation to our moderators and speakers of today. And ladies and gentlemen, mothers, often seen as the cornerstone of the family unit, bear the dual responsibility of nurturing their children while simultaneously managing their personal and professional lives. Children, on the other hand, are growing up in an environment saturated by digital stimuli, academic pressure, and social complexities. The mental health of the children is inextricably linked to the stability and support provided by their mothers. And by shedding the light on this issue through this conference, we aim to pave the way for a more supportive and understanding society that values and prioritizes the mental health of its most foundational members. And by this conference, let us all be guided by all the things we have learned and heard throughout the conference and be able to see and influence our future. And once again, please give a round of applause to all the speakers, remarkable speakers, moderators, and also today's committee. And excellencies, distinguished guests, participants, ladies and gentlemen, now we have come to the end of our second international conference on midwifery, maintaining balance, mental health and well-being of mothers and children in the modern era. On behalf of the committee, I would like to express our uppermost gratitude to all the speakers and also moderators for the knowledge shares, participants, and all the parties that have helped to make this event to happen. On behalf of the committee, I would like also to apologize for any shortcoming during the event, and hopefully this will be our lesson learned to continuously improve our quality. And lastly, please accept my poem, a verse. I sing in Melayu and I dance. Thank you and see you again in our next conference. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.